For the first time, the World Health Organization declaring the outbreak of COVID-19 a global pandemic.
We're not surprised to see something like COVID. We're now seeing anywhere between 2 to 5 new diseases emerge somewhere on the planet every year. Pandemics is one of those threats that I would put into the category of things like climate change and a nuclear weapon that really threaten humanity. The only way to eliminate it is working together and making that our strategy and our goal. It's a big word, but simply what disease surveillance means is finding outbreaks faster and responding to them quickly.
The Rockefeller Foundation has been a partner for a long time with CORDS since its inception. We have 6 networks in Africa, Southern Europe, Asia.
Each of these individual networks serves a critical role in regional health security. Together, they can learn from each other, which is allowing us to scale innovations and to foster collaboration across the globe.
Bringing together the networks to share their challenges when responding to COVID has made a difference. The Middle East Consortium presented several challenges they were facing. And immediately we saw other networks in CORDS offering support in laboratory protocols for disease surveillance and control at border areas, especially ground crossings has been identified as a problem in Africa. The networks working together across continents to support each other.
One of the greatest challenges is to get people to care about pandemic preparedness when we're not during an emergency.
The bill is passed.
When you look at the amount of just capital in the United States that's going to deal with the crisis here, a fraction of that money applied to help build these systems in all of the disease hotspot countries across the globe is exactly what we need, so we're not looking at another COVID-19 here in the years ahead or anywhere. The Rockefeller Foundation is really instrumental in this area of making regional surveillance a key factor for global health security. What is most likely to remain certain is that outbreaks will happen in these hotspot regions, which are based on lots of factors like where we have humans and animals in frequent contact. Now the sheer volume of people who are moving from hotspot regions to other regions and could be infected just add to that dimension. I feel very confident that we're making progress. I'm very optimistic that the change exists both in the mindsets, the science, and really the enthusiasm to end pandemics. We used to say at one time within our lifetime, but now we really believe we can end pandemics within the next decade.